Well, all right, everyone, and good evening. Good evening, and welcome to our BLAW Live for this Tuesday evening. So glad that you're with us today. And if you're here with us and you've been here with us for quite a while, Bishop Larry Ward is really about just really having stories that will educate you, inspire you, and help you to do better in life. My goal is just really to just help and to be a voice of help for those who are interested and also need the type of information that we're presenting. So if you're here for the first time, welcome. If you've been with us anytime during our series of BLAW Lives, thank you for coming back. Share with somebody, let them know that we're on, because we have a very important and powerful subject that we're going to be sharing tonight. And I'd like to introduce a great guest this evening in the person of Adrienne Gladden Young. And she's the Senior Research Associate for Pardis Sabeti Lab at the Broad Institute in Harvard University, where she conducts genomic studies of viruses and responsible for the world's most severe and deadly infectious diseases and outbreaks. She has quite a bit of work that she does in the area of epidemiology and research. For the past 15 years, Adrienne has conducted lab research and studying different viruses such as HIV, Lassa, Ebola, Zika, rabies, and hepatitis A, and in response to the global public health crisis. She's also spent a year conducting vaccine clinical trials to measure immunogenicity and flavivirus vaccine candidates. That's a big name. She's also spent time working in the biotech industry, and also she evaluates pathogen detection in system prototypes designed to identify biological threats found in the air and the different sample types. She's also a former member of the Massachusetts General Hospital Hazardous Materials Response Team, and Adrienne is formally trained in hospital-based response mass casualty events. She's mentored many students and scientists, a bachelor's of science degree in biology with a minor in African studies. And she's also has a master's in biotechnology, specializing in biosecurity and biodefense. And so it's great to have you with us, Adrienne. And thank you so much for coming and talking about this wonderful, really confusing issue of how do we deal with this whole issue of viruses and vaccines. So welcome.
Thank you. Thank you for having me, Bishop.
So I'd like to begin to talk this discussion. Talk about the work that you do at the Sabeti Lab.
Yeah, so in the lab, we study viruses that cause infectious diseases, viruses and other pathogens that cause infectious diseases. And we specifically look at the genomes of these viruses. So we have humans, our genetic material is DNA. And our DNA has all the instructions that we need to survive and to reproduce. And viruses also have genetic material. And so we look at this, the genomes, their genetic material, and we can we can use that information for a lot of things, to design diagnostic tests. What we've been doing for the past year is getting patient clinical samples, people who have COVID-19, and sequencing the viruses that are in their samples. And we have been able to track the spread of the virus throughout the state. And this virus genomic sequencing it's becoming a lot more popular now. Everyone is doing it because the information is so valuable. I know a lot of people have been hearing about these variants, and some are more spread faster, some are more cause more severe disease. Well, we are able to determine these variants by looking at the virus's genomes, and we look for certain signatures in the virus. And you know, that's how we determine like certain variants. So so that's what we've been doing for the past year, to support the response to this pandemic.
Wow. For me, I'm not in the biotechnical and biochemistry field at all. Um, so when you're talking about all of these infectious diseases that was named in your bio as you worked on these, um, why has this virus, COVID-19, been worse than anything you faced before, or has it?
It has been the worst, at least in my lifetime. I think it's because it's like everything, the worst of everything has come together in this one virus. So if you think about it, we started hearing about this virus maybe in late December 2019. And that's right around the time flu season, the time where people are getting other respiratory infections. So we were truly blindsided because a lot of people, maybe they were infected and they didn't know. They thought they had a cold or the flu or something else, and so they didn't seek medical attention. So people weren't alarmed. Even if people had pneumonia, it's still that time of year where people are experiencing these symptoms. So there were no COVID-19, at least for the most part, there weren't like these distinct symptoms. So they were easily confused with flu or some other respiratory infections. And then the virus, it's transmitted very easily, and people are traveling back and forth around the world, and so it was spreading. It wasn't even in certain countries at first, and then it's spreading. So we couldn't detect it, and then we couldn't contain it because by the time we did detect it, it had already started spreading like uncontrollably. And then we're learning more and more about the CDC. They always give like these recommendations, and at first I think the recommendation was, or the guidance was, that masks were not needed. And as we learned more and more about the virus and the way that it was spreading, then we realized masks do help protect and prevent transmission. But there were some people who were like, well, you already told us not to wear masks. So then it was hard to keep up. The communication could have been better. So I think that was another reason that it was so bad. And then there's this incubation period, right? People are infected and then they don't have symptoms for like almost a week, but they're still contagious. So the
Wow.
virus is spreading before people even knew that they were sick.
Wow.
And so, yeah, we did this one case study in a congregate living facility, a nursing home, and we saw that 59 people had the same virus, which means that they were all infected by one person. 59 people in one place, and 24 of them died within 2 weeks of
Wow.
testing positive.
Wow.
So it was like spreading really fast. I mean, spreading very easily. We call it super spreading. That was happening a lot too. So it was just like everything at once. All the worst, features of other infectious diseases, they just all came together, and you know, and then now we have this pandemic that has just been devastating.
Wow. So that's very concerning. When we get into this understanding of what it really means to be on the front lines, and particularly, I just want to ask you a question: what you're seeing as it relates to communities of color, and when it comes to COVID, and why are communities of color so more vulnerable than other communities?
You know, so I don't think that I don't think that they're inherently vulnerable. I think that we have been made vulnerable. There was
How
a
so? How so?
So there was this study done by a company in Boston actually last year, and they determined that in the United States, Black people were not getting referred um, for testing. This is early on. If you remember, people who had traveled, they were getting tested, but other people, they couldn't get tested. And then when testing became a little more widely available, Black people still were not being referred for testing. There was lack of testing in certain in our neighborhoods. So if you're sick and you bring it back to your community, now it's spreading and we don't even know it. And so that also delays treatment, because if you don't know that that you have COVID 19, you can't get the treatment that you need. And we saw that the later the treatment, the worse the outcome. So
Wow. So,
I think there was like a lack of access to resources. That was one of the things. I mean, there I can go on about the
and so
reasons
it
why
leads
we
into the
didn't
next
really have
question.
it.
It leads into the next question. That my thinking is like, okay, well, is this systemic racism that we're seeing unfolded? And what's your thoughts around that? And what part did it play in so many people of color dying at twice the rate of any other group?
Absolutely. And I say it's not just racism. This is not like an individual level. This is like systemic. There are issues with the system. If you think about the testing criteria, that automatically excluded certain groups of people. If people weren't traveling, abroad, then they wouldn't have access to testing. That automatically, that kind of like already set the bias, and then you know there were certain hospitals or healthcare providers that didn't have certain access to certain treatments. So if you think we're coming in already at a later stage in the disease,
Mm.
and so we're probably sicker, and we're going to places that don't have treatment. So of course the outcome is going to be worse, because people can't access treatment. I had a family member who went to one hospital in an area that was like predominantly, but it was a community of color, and the hospital did not have, these treatments that we, saw work. And so I immediately told her leave and go to this hospital, and this hospital was, in it wasn't a community of color, and they had access to all of the treatments. And I'm thinking how, this is how these disparities are created, because people can't access the resources that they need to keep themselves safe and healthy.
Wow, that's really eye opening. Um, and of course we, from my vantage point, a little bit more in depth of what's happening because you're on the front line than I would. But that's just some really powerful information. And so now we have a vaccination. We have three. We have Pfizer, Moderna, and we have Johnson and Johnson out there. Um, People are hearing about it, but is there still a lot of fear of people getting vaccinated, particularly people of color?
I think everyone was cautious, people of color and other. I mean, just everyone has been cautious because um, if you don't understand the way that vaccines are created, you might think, this came out of the blue. Less than a year, all these vaccines were created, and it's so, of course, people are gonna think that maybe they're not safe. Um, but this research was, being done in the background all along for years, and not specifically for the virus that causes COVID-19, but for very similar viruses and infectious diseases. And so, and so I, yes, so people were fearful. People are fearful and very cautious. And I think that some caution is definitely warranted, especially with the history, especially in the United States, the history that Black and Brown communities have. Um, I think the fear is warranted.
Yeah.
Um,
Yeah.
yeah, I think it's warranted. That's what I'll say about that.
And so the, you know, where people are afraid and people are concerned, there's a lot of information that's out there. So we got a question from the audience, and I just want to just let everyone know that if you do have a question, you can put it in chat into your chat box, and we'll be able to get it up here and have Adrian answer some questions. Um, so the question came up: well, what advice would you give people of color, especially the Black community, um, who are reluctant to getting this vaccine? What would you say to them as a researcher, being on the front line, understanding infectious disease? What would you say to them?
I would say seek information from people, sources um, people who are knowledgeable, who actually know what they're talking about. Don't just Google, information, and then, like, make sure you're listening to, and um, people who know what they're talking about,
Well, well,
and
well,
seek
well,
information.
we're coming from a person that is not a doctor. They said, I'm not a doctor, I'm not a biochemist, and I'm hearing information from CDC. I'm hearing information from my local authorities. I'm hearing information now that, they're saying, if you've been vaccinated and after 2 weeks, and you're in your household and everybody's been vaccinated, just don't worry about no mask and don't worry about none of that. Um, what question should I be asking? And when it comes to who's telling me what things should I be looking for that says, aha, this is something I can go on, that some trusted information that I can buy into?
I you bring up a lot of good points. I I think that the communication could be a little bit better. But I would say, go if you have a primary care doctor. I would say, for me, that would be the first person that I would talk with, because they know your health history, and they know if the vaccine is right for you or not. For me, I don't necessarily tell people, even though I know that the vaccines have been shown to be very safe and effective. I don't try to persuade people either way. I try to give them information, so that they can make their own decisions about whether or not this vaccine the vaccination is right for them. And I think that your primary care doctor is in a good position to tell you, to help you make that decision. Based on your history, they will know, if you'll experience any adverse side effects or anything like that. Um, but we do have enough data that has shown that the vaccines are safe and they are effective. And all three of the vaccines are 100% effective, against hospitalization and death, and severe disease and death. And that's what's most important. So I mean, we have that information already available.
So you would say as a scientist, you would say, if there's nothing else, get the vaccine, because you will certainly mitigate the risk of being hospitalized in death. Is that what you're saying?
I am saying that based on the clinical trials, right, there were zero cases of severe disease, hospitalization, and death. There were none of those in all three of the vaccine clinical trials.
Mm.
So to me, that says that that's better than getting COVID-19, because you don't know how you fare. You know, if some people experience mild symptoms, but others don't. You know, I had family members, seniors, who I was really worried about because they had, you know, some comorbidities, and they had mild symptoms. And then I had another family member who was 40 years old and died from COVID-19 5 days after they turned 40. So you
Sorry to
don't
hear
know how you'll fare. And it's best to protect yourself. And if there's, you know, this kind of protection that's available, why refuse it?
Wow. So as you probably have heard in the news, and that's been, you've been giving some good advice about why you should get it, because you want to minimize the chances of you going into a very severe situation of losing your life. So as we're looking at things are opening up, states are opening up and loosening restrictions, and not on the same, you know, and everybody's not going at the same rate. So what might you be concerned about as a researcher, and you've been really working on the front lines of this virus? We have Anthony Fauci and others who have said, I think some of us are opening up too quickly. Where do you stand as a scientist? What advice would you say? Would you say, hey, we're going too fast. We need to slow it down a little bit. What's your thoughts on that?
It does make me nervous that some states are opening up right now. I think that, I mean, we've waited this long. What's a few more months, you know, and some, you know, a million more people, or a few million people can get vaccinated. Um, why rush it now? You know, we're almost there. We're almost there, but I don't think that enough people um, are protected yet. Um, so that for me, that would be the mark. As soon as, you know, I don't know, seven. I can't give an exact, you know, percentage, but as soon as, you know, enough people are vaccinated, you know, they're safe. You know, then you can start opening up. But before then, I think, yeah, I think things are happening a little bit prematurely.
Thank you. Now that's a big question I had in my mind as well. How fast are we going, and how slow should we be going? And I have a question from the audience, and another question comes up of, so why is it taking so long for vaccinations to be distributed? Last month, Governor Baker received you know, an F for his COVID vaccination plan. That means it wasn't really on par, nowhere near what was expected. We have some crashes with the systems as well. So as a scientist, how do you connect? And then when I look you to talk about this, I'll just give you another question in a moment. But I just like to, from your vantage point, why is this taking so long?
You know, it takes a, like you asked earlier, like, why is this the worst, you know, that we've ever, you know, the worst infectious disease, the worst pandemic that we've ever, you know, experienced in this lifetime. Um, Everything is unprecedented. You know, no, we haven't had to make this amount of vaccine in such a short amount of time, like in this lifetime. So it just takes a while to actually make the vaccine. And then, you know, um, a couple of the vaccines require certain, you know, there are certain storage requirements. And so if a facility, you know, wants to become a vaccination site where they don't have all of the resources to, you know, to safely store or administer the vaccine, then they have to wait to, you know, get the site ready. But I think it's just we didn't have a system in place to be able to vaccinate, to mass produce the vaccine and then to vaccinate the public, the population in this short amount of time.
So we're just trying to catch up to catch up and catch up and catch up and catch up. So 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 now that we have this massive need and we have suppliers that are trying to catch up, we have three suppliers. You have Pfizer, Moderna, and you have Johnson & Johnson. So question comes up, well, what's the difference in these vaccines? You have one that has one injection and you have two of them that you have to get two injections. So what's the difference?
So basically it's the difference is the technology to get the vaccine into your cells. That's really the only difference, because all of so the point of the vaccine is you want your body to be able to recognize the virus, or at least part of the virus, so that when you're and build up an immune response, so that when you are exposed to the real virus, then your body will already recognize it and know how to fight it off. And so there's a part of the virus called the spike protein, which is needed for the virus to be able to get into our cells and cause an infection. And so all of the vaccines, all three of the vaccines, have this spike protein. That's the only part of the virus that each of these vaccines have the spike protein, so that our bodies can build up an immune response to the spike protein. So when we're exposed to the virus, our bodies will be able to fight to destroy the spike protein, and then the virus won't be able to infect our cells. So it's really just the delivery system that's different. The vaccines are all for the spike protein. And
so the delivery system, when you're saying the delivery system, so I'm interested to just kind of push a little bit. Why did the others, it takes two injections versus Johnson & Johnson only takes one injection? Was it because they had a little bit more time to study, a little bit more time to develop? Why is it one versus two?
Yeah, well, that part I don't know, because I wasn't, I didn't design the vaccine, so I'm not really sure what went into the preclinical tests, so that they determine, this is the amount that's required. But actually, so the Moderna and the Pfizer vaccines use actually a new technology. They're mRNA vaccines. So remember, I was telling you earlier that we look at the genetic material of viruses. Well, the virus that causes COVID-19 has genetic material that's RNA. And so this actually is a technology that has been around for maybe a decade or more. It's been testing, but it's actually new. This technology is new for these vaccines. And the Johnson & Johnson, I just want to say this before I forget, and the Johnson & Johnson vaccine is actually not a new technology. It uses a viral vector to introduce the spike protein into your cells, whereas the Moderna and Pfizer vaccines gets the RNA into our cells. And then
what is RNA? What is all that? Is it a code? Is that an RNA is a code? What does that mean?
Yeah, it's like, so we have our genetic material is DNA, and then from DNA we make RNA, and then we make proteins. So the vaccine introduces this RNA the RNA has instructions for making protein. So the vaccine gets the RNA into our cells, and it now has the instructions for our cells to make the spike protein from the virus that causes COVID-19. So now our cells are producing the spike protein, and now our immune system can recognize the spike protein and say, hey, this is like foreign. So we need to mount an immune response, against it to fight it off.
Wow.
So yeah, the RNA is just basically just instructions for our cells to be able to make the spike protein. Whereas the viral vector, it's actually a virus itself. So it can't replicate, it can't actually cause a real infection, but it's actually a virus itself. So it knows how to infect our cells, and then it presents this spike protein to our bodies, and then we can mount an immune response.
Wow.
I hope that was.
You said a lot. You said a lot in a little time, but that's very helpful, because that really gives at least just an understanding of what is actually happening inside our body as the vaccine is recognizing and fighting off any type of foreign viruses and things that could come into our body. So we're going to go a little bit longer because the questions are still coming in. So thank you for asking questions, audience. And so a question came in that talks about the side effects. So many people have side effects. And the question is, they have side effects from the vaccine. What are you hearing about the side effects? And should this cause any concerns for the public? So side effects could be people getting pain and soreness and all these kind of things that are happening after they get the vaccine. What's the concern with that we should have, if any?
So I don't see patients, so I can only go based on what I also hear in like the news and everything. But what I will say is that the most common side effects are pain at the injection site, which is something that you would experience if you got any vaccine, injected into your the muscle in your arm. I got a flu vaccine and I could barely lift my arm for like 2 days. So that would happen anyways. And then a lot of times people will experience a fever, maybe like very mild, like flu-like symptoms. But again, you probably have heard of other people experiencing those symptoms after getting the flu vaccine as well.
Yeah.
And I think that's like the fever is like a sign that your immune system is working. So it's not necessarily specific to the vaccine. It's an immune response.
Wow. That's good to know. I mean, you're gonna get some mild symptoms, and
you might. Some people I've heard some people haven't, but I've heard of enough people, getting those symptoms that I think they would be considered common side effects.
Common symptoms. Okay, that's good to know. Thank you. Now, another question is, someone wants to, they have cabin fever, and they don't want to just travel within domestic travel. They want to do international travel. So what would you say to somebody trying to, hey, book a trip outside the United States?
Wear your mask. If you can wait. But if you can't, I mean, like, I feel like, we have to consider ourselves, but we also have to consider, everyone else, because this is, this virus is so easily transmitted from person to person. We don't know what we might, we're hearing a lot about these variants, right? We might have a variant here in the US that is not somewhere else. You don't want to be that one to be the first introduction somewhere else. Why take that chance? Maybe just wait, because there's still studies being done. So even if you're vaccinated, um, it's it's not likely, but it's still not impossible that you could actually transmit the virus to
Wow.
someone else, even if you're vaccinated. It's not likely, but it's not impossible. So there's still some risk. And so if you're around people who are not vaccinated or not protecting themselves in some way, then there's still risk that you know someone might get infected.
Get infected. Yep.
So I wear your mask, or just wait a few months, and
At your own risk, because that's kind of what it is.
we'll all be at the beach at the same time.
At your own risk, I guess, right? Yeah, that's, thank you. Um, Question came in. How long does this vaccine last, and how long could it be effective once you receive it? And if a person is vaccinated, does it guard you against the other variants and variant types of infections that you could get, or viruses that are out there?
Well, viruses. So this vaccine will not protect you from other viruses. Um, there may be some um, what they call cross reactivity. So um, there might be some cross protection for other coronaviruses, but I don't know that to be true. I know that it's possible, but I don't know that to be true for sure. So I would say, other than coronaviruses, I don't the vaccine will not protect you from other viruses. Um,
So would you say that we may have to get another booster shot of some sort?
from other viruses. So like this vaccine will not protect you from the flu, or it will not protect you from other hepatitis B, or what other viruses. But I don't know how long the immunity lasts. I know that the clinical trials started. Um, I think it was maybe 6 months ago, and I and maybe more than 6 months ago. And I think that people were still had antibodies at the 6 month mark. And I think maybe maybe all of the clinical trial participants haven't reached that 6 month mark yet. So it's not really clear, if everyone will have, how long the immunity will last.
Wow.
But the hope is that it will last, long enough long enough for this pandemic to end.
Wow. Wow. That's
Um,
very interesting. That's very
yeah,
interesting.
and then they have done tests to make sure that the vaccine is protective against these new variants that we're seeing.
Mhm.
And for the most part, the vaccines are still effective and protective against the variants. There might be a little the protection might be a little um, lower, but it's still protection.
Wow. That's very insightful. Thank you for giving us that information. Got a question that came in, and parents and are very concerned about their children going to school. So now, I know in the city of Boston and different areas in Massachusetts, um, children are back in school, and as they start going through the month, they're starting to release more of school-age children from middle schoolers into high school. Um, so the question is, um, as you're looking at parents and children, who may be able to return to school, or school-age activities and summer camps and activities that they want to get their children involved in, and what would you say about that?
I would say that it would be important to make sure that the adults around the children are vaccinated, because the vaccine is not available for kids right now. Because otherwise, I would say just make sure that they get vaccinated, and then everyone's safe, but it's not available for kids. But as long as the adults around them are are vaccinated, then like you're stopping these transmission chains. And so that will make things a little bit safer. And then, just if they're willing to wear masks, just ask them to wear their masks as long as, it's necessary. Um, yeah, I think that the schools are probably just hoping that the students will be willing to wear their masks, so that they can go back to, in
To
person.
go back to normal as much as normal can be. Yeah,
Yeah.
I
I mean,
understand.
I completely understand. I have a preschool age daughter, and she's always like, I want to go back to school. Like, I miss my friends. I want to go back to school. So like, I understand, the need for, um, kids, students being back in person in school, and as long as, but they still have to be safe.
Thank
Um,
you. That's that's very insightful. Now I'm only gonna have one more question for you. It may be kind of in a two-part because we're gonna end at 7:45 in about 5 minutes. Um, you're also pastor's wife, and so um, when it comes to pastor's wife, a researcher in the area of infectious diseases, your house of worship, um, how does this balance all out for you during this pandemic? Because I'm sure you're getting questions of vaccinations. Maybe should we open up or not? What's happening?
it's funny because it was even before the shutdown. I remember telling my husband, I'm like, I'm not going to church in person, and neither neither will our daughters. We're not going to. It was before the shutdown, but I saw the direction that things were going in, and I just knew that that it wasn't going to be safe. And sure enough, like over this past year, especially early on, we were seeing a lot of super spreading events in churches. And it was the loss, the the church has lost so many people. It's been devastating. Um, like I It's been devastating. And so like I know that we want to be in church together. We want to worship together, but we also want to, stay alive. So, if we have to hold off for a few more months, then, so be it. That's my recommendation until, it's safe. Um, until it's safe to go back in person. I miss it just like everyone else. But I also know that if we do it prematurely, then you know we we could lose a lot more than we're ready to lose.
Wow. And so, how do you integrate your faith in your work, in your science, and just integrate faith, science, and the work that you do? How do you integrate all that?
At the beginning of the pandemic, I prayed and I asked God to use me, to help, because in the lab we've been doing this work for a while, um, and I've kind of always, I've done my work, but it was like, I do my work, that kind of thing. And I asked God, it was probably this time last year, to use me to help. And it, the way that things just started happening, um, you know, that that I was able to be a voice, where people um, didn't have a voice. Like I was able to point out blind spots, in our research, people things that people hadn't even thought about before. I knew that that was like, God using me to be able to help. And so everything that I do, You know, like I might not be able to make a big difference, but I know that as long as I'm doing what God tells me to do, then I'm gonna help somebody. um, and so that's all I can do is, you know, just ask God to use me and be obedient. You know, when He tells me to move, move. He told me to, you know, apply to grad school, to PhD programs, and I hadn't planned on it. And this is like, you know, I think I thought about it in like the end of September. And people, you know, they plan these things like all year, for these things all year. I did everything wrong. I'm listening to other people talking. They're like, "Oh, you did this wrong. You should have done this, and you should have asked this, and you should have written this, and everything." But I knew that I heard God tell me to do it,
Mm.
and I applied. I only applied to 2 programs. That was okay too. You know, I got accepted, and now I will be in a position to do even more works. You know, greater works shall we do in His name, and you know, so I think that you know, you have to be willing and obedient, and
Oh,
that's all that I can do. And I just hope that I can help in some way.
that's awesome. That's awesome. Congratulations on your doctoral program that you're about to begin. And also your husband's going to be beginning his doctoral program as well. So he's just a shout out to Pastor Kenneth Young. Thank you so much for being on the broadcast tonight as well. And thank you so much for taking time out of your busy schedule, because I know that the work that you do is a lot of time and effort that you put in. And I'm sure that there are days that you're exhausted. And so I want to thank you so much for giving us your time and helping us understand better how to deal with this pandemic and work through this process of getting our vaccinations. So you made us feel a lot more secure. I know for me, I'll talk personally for me, you made me feel a lot more secure even about talking about the vaccinations and giving people an explanation why certainly I'm vaccinated, and I want to encourage them as well. So thank you so much. I appreciate all that you're doing. And so for those of you who are online, just want to thank you so much for being here. And certainly we'll ask you to tune into BLAW Live, share with someone this broadcast if they just want some more information about vaccines. And this was a great time of sharing with Adrian. So Adrian, bless you. May God smile on you. And as you do your work, may His hand be upon you and to reach many people and so into many lives. So thank you so much.
Thank you.